Evidence Now Southwest presents Training Your Practice to Make the Most of Your Patient and Family Advisory Board. Practices are placing increased emphasis on collaborating with patients at all levels of care and in all healthcare settings. One key component to patient and family-centered care is engaging the patient in their own care. Another key component is having patients and their families work with the healthcare team to determine the best course of action to improve processes. This is often done by having patients and their families on QI teams or advisory boards. Patient and family engagement can bring great ideas and new perspectives to support the decisions the practices make about improvements and change. They can also save you from wasting energy on improvement projects that wouldn't matter much to patients. Recruiting patient and family advisors can be a motivating journey. You will want to find patients, caregivers, and family members with diverse perspectives who can share insights and experiences in a productive way, who are collaborative in nature, listen well, and are comfortable speaking in a group, and have a passion, like you, for improving the healthcare experience for all. To learn more, check out our video on recruiting advisors here, or by visiting the Evidence Now Southwest channel on YouTube. The facilitator of your patient advisory group or QI team doesn't have to be a practice leader. People in many different roles in the practice can take charge of working with patient and family advisors. They can be either formal or informal leaders, but they may need skill building in facilitation to succeed. Here are some key characteristics to look for in a person within your clinic who might be a good point person for leading a patient and family advisory board. Here are a few tips for your PFAB facilitator. Actively engage everyone in the process. Help everyone figure out how they can contribute. Be transparent about information and data. Buy into a true team approach. Develop a facilitative style, knowing when to push and when to pull. And lastly, make time for reflection. Leading any team through change, including teams with patients, requires skills and tools that complement a champion or facilitator's talents. Some methods that will lead to successful outcomes with teams include collecting feedback from beginning to end of the project, building shared priorities and values, communicating 7 different times in 7 different ways, providing meaningful data at all levels of engagement, taking time to engage, educate, and train all members of the group, and focusing on building relationships and trust. Communication is key and helps spread a patient-centered culture. Advisors need to know how their feedback has been incorporated or reasons why it wasn't. The clinic members and staff need to get insight into patient and family advisor feedback, and other patients need to know there is an advisory group that represents them. The more this communication happens, the more you might find your practice members asking, "I wonder what patients and families would say about that." And don't forget, skill building is important, but so is having fun. The best way to support this work is providing the time, space, and if possible, funding to encourage activities that bring advisors and practice members together in a safe space to share their experiences while having a good time doing it.